these, and we'll... Okay, now the interesting thing, you've got a brand new technology that enables you to provide somebody with a Hollywood smile, both top and bottom, for less than 5K. I mean, this is amazing.
What about for less than 2K?
What about? Well, I mean, we don't want people to think that this is a con operation. I mean, this is really new. This is new technology. And when you say 2K, that's just for one. That's either the lower or the upper. That's correct, isn't it?
Yep.
But if you wanted to have both for a real Hollywood smile,
and it's very easy. It's usable. You can eat with it. You can wear it. It's like clothes for the teeth.
Right, but you need to have a lot of training, obviously, as a dentist. Not only as a dentist, but also you went through a special course in order to be able to understand how to make this this snap-on smile, didn't you?
Absolutely, it requires lots of understanding of occlusal forces and what's going on in the mouth, because this thing.
So this is not a denture. This is completely different. This is new tech.
This is not a denture. It's a special material which is almost unbreakable.
All right.
Specifically designed.
I'm just going to pause this for a second. There.
Right.
So this is not a denture. This is something that is brand new.
Absolutely. It's been designed to be snapped off on the teeth and hold in there, and it's actually functional.
Let me just zoom in on that, because I can get quite close to your hand over there.
People can eat with it.
All right.
It's very easy to snap on and off. It's very easy to clean.
Okay.
And you don't have to remove it every time after you eat.
Oh, you don't?
No.
Oh, okay. So unlike
can,
dentures, which sometimes have all sorts of little bits and pieces of food stuck in them, this is much.
This one does not cover the palate. It doesn't cover the gum.
Ah, so you don't have that horrible feeling at the top of the mouth.
Absolutely nothing. It feels like your own teeth.
Right.
And when you come home, before brushing your teeth, of course you remove it and brush your teeth as normal. And you don't have to put it at night, obviously, but in the morning,
put it back in.
You can put it back in, and that's about it. Also, you can use it for special occasions when you need a smile.
Yeah. Well, I mean,
sometimes you need a nice smile. Sometimes you need a.
Sometimes you're just sitting in front of the computer and you don't want to bother, right?
Really
Now, just as a matter of curiosity, and also for those watching, how long does it last? You know, I mean, at a price of less than $5,000 for something that would normally cost, you know, with traditional dental techniques, $25,000, $30,000, people will say, oh yes, it's, you know, he's never going to look exactly the same.
As far as the look of it, because we're not touching the teeth, we're not doing anything on the teeth, and it goes over the teeth. The look may be a little bit different, but we're working to make it appropriate. And
so nobody is going to know. I mean, that's the big question that people will have.
Unless you show them.
Well, no, but you know, in terms of, you know, a $30,000 beautiful mouth, you know, is now being compared to something that is, you know, $4,000 or $5,000 if it's done top and bottom. If we put 10 people side by side and we said who's got the snap-on, who's got the $35,000 job, do you think most people would be able to tell?
Most people not, but
obviously dentists will be able to tell, but you know,
normal people will not.
Well, I mean,
dentist will. What it also does, it kind of prepares people to have the more expensive work, because you know you can spend $30,000-$40,000 on the teeth and may actually hate it.
Yeah, absolutely. Yeah.
And this way you have something to try it on. Basically, you can try on smile for a few months, a few years, until you decide that that's
okay.
What you want.
So you can. But when you just said something very important there, you said a few years. So this is not something that's just going to, like Botox, only going to last 6 months, and then you got to go and, you know, have another set of injections.
It usually lasts between a few months and a few years, but of course it's
a new form of technology.
It's something that is wearing off.
Okay, so
it's something that has to be replaced periodically, but it lasts
at least 18 months.
Yes.
Okay, well that's fantastic. And for all those out there, just underneath you'll see the form. Just fill in the form, and we can give you a free consultation.
Okay, definitely.
Okay, well thanks very much indeed.
And also it's a good thing for the temporaries, where if you're missing teeth, or if you just had an extraction, or if you just had an implant placed.
Okay.
Over here on the model there is a implant healing cap
goes
right
there,
here.
yeah. Okay.
And that requires some kind of temporization.
All right.
That can be achieved with that. It doesn't have to be a full arch, it can be only for a few teeth or for the half of your mouth.
Oh, right. Okay, so
in this case, it shows everything.
okay, so I mean, you don't have to have the whole mouth. You can just have one part or another.
Absolutely.
Okay, and what was it like playing Dr. K in the latest James Bond movie?
That was good.